Okay, hi Paulette, it's Dr. Buford. Just getting started on your right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen, and right now we're just putting in a shaver. And we're going to look first at the biceps tendon. Tendon looks good. The insertion site looks a little degenerative, so we'll take a free hi-fi suture and a shuttle relay and do what's called the biceps tenodesis, because that can be a source of pain that we don't want to leave here. We know you've got a partial thickness cuff tear. We're going to decide if we have to fix that. But right now, we're going to start by just taking care of the biceps. As they're getting that ready, I'm going to look around the rest of the shoulder. We can see you've got some areas in the humeral head up above where you've got some loss of cartilage. There's an area down below in the glenoid. The capsular structures look okay, but look, there's another area on the posterior humeral head that's got some cartilage thinning as well. And as we look down the front here, we can see the anterior capsular ligaments. And those look normal. So we're going to get to work. We're going to take a spinal needle and a shuttle relay first. Grasp it a little. And so in just a second, you'll see our spinal needle coming in. There it is, right down the center of the biceps. Careful here. So you'll see a black wire come through that needle. Okay, so now we are holding the wire still. We're going to just take the needle out. And now we'll take that free suture and we're going to load the relay here. And as I pull back on the relay, you'll see the suture. There it is right there. That's great. And now we're going to repeat the process with our spinal needle. And then after that, we'll need our relay and then a pair of arthroscopic scissors. So right now, we're going to try and come through the biceps tendon again. We're going to pass the relay through. In a second here, we're going to need a grasper. And then after this, we're going to back the needle out like we did a second ago, and then we'll need the arthroscopic scissors. Okay. So we'll just hold this still. And then the trick here is once we back the needle out, we're going to now release the wire and retrieve it around the backside of the biceps just like that. We'll show you some more in a minute. Okay, so we've released the biceps. You can see the cut edge of it there. And now we're going to look at the rotator cuff. I really don't see any significant tearing on the articular side, which is what we expected from the ultrasound and our imaging. But we're starting to find a little area right about there that may be thin and partially torn. I'm going to clean up the edge of the biceps tendon here, and then the next thing we'll show you will be our work in the subacromial space where the bone spur is and where we can get a good look at the rotator cuff. Okay, so now we look down at the rotator cuff. And the area where the tear is going to be... Okay, so now we're just unroofing the tear here. It's essentially already completely torn. We knew that, again, from our imaging. You can see just a little bit of shaving. You can see we're already down into the joint. Okay, see that? So that's how we know we're in the right spot. We're all the way up to the front because we can see our bicep sutures. And now to repair this properly, we're going to clean up the edges. And that's pretty much it. Now we're going to look towards the back and see if we need to remove any more to the back. Even though this is torn, I don't want to take it down. We can use that. And so we'll stop here and get to work fixing that hole. Spinal. Okay, so now we've got our suture anchor in. Just for orientation, this is the back of your shoulder. This is the front over here. Where we took off the bone spur is that cut edge right there. See how that's nice and flat? And then we're going to look down. There's the hole in the cuff. And these are all the sutures coming from the anchor. So we're going to reach in here. And I think I'll grab this anchor first. Hold the cannula. Okay, so we're done here. Here's the rotator cuff repair. You can see the 3 sutures lined up. The hole's gone. We put the biceps sutures down to the bone with an anchor. And so that's secured also. You can see those sutures have good tension on them. And then as we look towards the front, we can see the rotator cuff, the bone spur rather, off the acromion has been smoothed out as well.